I'm David Farley. I'm a general surgeon. I went to medical school at Wisconsin. I'm a Wisconsin farm boy. I'm married with kids and really enjoy my job at the Mayo Clinic. I trained here for 6 years in general surgery, did some 6-month specialty training in Germany. I'm interested in minimally invasive surgery, endocrine surgery, laparoscopic surgery, and lots of bread and butter surgery, taking out gallbladders, breast cancers, you name it. I like to do it. I have been the program director at the Mayo Clinic General Surgery Training Program for 15 years, and I'm no longer in that capacity, which now gives me a lot of time to teach and educate, which is really what I want to do. But my focus has always been on training young surgeons to become master surgeons or expert surgeons, if you will. And one of those avenues for me to train is to do it by video. So what I'm trying to do with video and video learning and online learning is allow people in their spare time to voluntarily look at some material and say, okay, tomorrow I'm going to operate with Dr. Farley and he's going to take out a thyroid gland. We're going to take out a thyroid gland together. What are the steps of that operation? If you've never done that, it's really not as great a learning opportunity as if you've sort of seen that roadmap, if you will. And so that's what I'm all about. I'm trying to speed up things, make it more efficient for young surgeons in training. So at the end of their 5 years, they can be as good or hopefully better than Dr. Farley was, and that's the ultimate goal for me. I see the benefit in the internet and the masses that you can reach, and at some point in time, want to touch more lives with the things that I'm doing. In our own institution here, the modules and the surgical educations work great. We're very pleased with it. Sophia was looking to push borders and cutting edge and asked for a couple of modules, and I've given them that. They've done a nice job on putting things together so it's easy to view, easy to look at. But the video clips that I've created are a little bit different in that it takes somebody through it step by step and tries to be patient and tries to explain. It's not geared immediately for the world experts in thyroid surgery or pancreas surgery. It's geared toward medical students and trainees and perhaps patients or others that just sort of want to get a sense of how is this going to happen and what should we be thinking about and how can we make this safe and what are the key steps. So I've tried to very much make it simplistically and logistical to follow, that at the end of it you may not be a top-notch surgeon, but you can at least understand the stresses and strains and the key things that need to be done to perform it well. Patients are out there looking for information. They might have a lump in the neck and need a thyroid operation. These videos might be of benefit to them. It might serve them. A medical student is studying for a test, and that information will be of benefit to them to pass the test. For young surgeons in training or surgeons that need to refresh and refocus to see how somebody does it at the Mayo Clinic or Duke or private practice Wyoming, I think those are all educational opportunities for us. And I think it's the easiest way to touch 200 million people is through the internet. And we're not going to be static with these video clips. The video clips that are out there right now that Sophia has are basically geared toward a surgical intern, getting familiar how they would take care of this. We are in the process, and we've already made hundreds of video clips for nurses. How would you take care of somebody with a thyroid operation or an adrenal operation? And then we need to make, I think personally, we need to make video games because people are more engaged with that and they learn more and they retain more. We can make the game for a patient that you're going to have your gallbladder out. Why don't you play the game? Let's see if you can take out your own gallbladder, knowing, oops, you might not be perfect at it, and thankfully your surgeon or physician or whatever it is that we're talking about is talented enough to do it, expertly.